To start by inspecting his chest and his abdomen. His skin is appropriate and is warm to the touch. His chest is symmetrical. His umbilicus, I see no problems with that, and I see no visible peristalsis. I'm then going to move on to auscultating. I will start in the right lower quadrant. Moving to the right upper quadrant, left upper quadrant, and left lower quadrant. I hear active bowel sounds, normal active bowel sounds in all 4 quadrants. I'm then going to percuss in all 4 quadrants. I hear tympany in all 4 quadrants. I am now going to percuss for the liver. I'm going to go at the midclavicular line, out from the umbilicus, percuss my way up till it changes from tympany to dull. Right about there, I'm going to mark that spot. I'm then going to continue to go up into the intercostal spaces where it changes from dull to resonance, and that is about a 2 to 3 centimeter space there. I'm now going to percuss the spleen in the 10th intercostal space on this left side here at the axillary line. I can hear dullness on percussion. I'm going to have you take a big deep breath in and hold it. Good. And now I hear resonance. You can let it out. So that means his spleen is not enlarged. I am now going to do light palpation in all 4 quadrants. Just let me know if you have any tenderness, okay? Any tenderness?
No.
Good. I feel no masses, no rigidity, and no lesions. I'm now going to palpate for the aortic width. So right above his umbilicus, I'm going to feel where it is pulsating. And then I'm going to move over from there. So I'm going to mark that one. Then move over till I feel it pulsating again. And that is about 2 centimeters. So his aortic width is about 2 centimeters there. I'm now going to do deep palpations. Just let me know if you have any pain. All 4 quadrants. Any pain?
No pain.
No. Okay. I feel no masses and no rigidity. I'm now going to palpate for the liver. So I'm going to go on this right side under the ribs here, where I can just feel the border of that liver on that patient, this patient. Now I'm going to palpate for the kidneys. So I'm going to put my hand under his back and try and palpate. I do not feel the kidneys on this side. I will not palpate on the other side. I do not feel the kidneys on this side either. Okay, I will now have you sit up. We will do CVA tenderness. So I'm just going to strike, put my hand on the left rib and then strike it with a fist. Do you have any pain?
No.
No? So this means that this patient does not have any kidney tenderness. Any pain?
No.
Patient does not have any pain on CVA tenderness. Good. We are now going to move on to the musculoskeletal assessment. So you can sit up on the bed here. I'm going to start by just inspecting his muscles and his joints. I see no edema. I see no inflammation. Let me know if you have any pain throughout these range of motion tests. And then if I hear any crepitus, I will let you know. We're first going to start with the neck. So we are going to flex and extend. Good. Laterally bend. And then rotate. Good. The patient has full range of motion with these movements and no crepitus. Now the shoulders. So adduction and abduction on both sides. Good. And the other side. Yep. Good. Full range of motion. Internally rotate and externally rotate on both sides. Good. I hear no crepitus, no pain.
Nope.
And the patient has full range of motion. Now we're going to move down to the elbows. So we're going to flex and extend, supinate, hands up, and then pronate, hands down. Good. Patient has full range of motion. Now we are going to flex the wrist and extend. Good. Full range of motion. Flex the fingers and extend. Good. Patient has full range of motion. No pain.
No.
Okay. Lay on your back. We're going to do your hips. So I'm going to have you interiorly rotate. So you're going to move your hip that way. So lift this leg up. Yep. Good. And anteriorly rotate. Good. Do it on the other side. Good job. Patient has full range of motion with this. All right. And now flex your hip. So up. Just go straight up like that. Yep. Good. And the other leg. Good. Full range of motion. And then adduct and abduct. So away from your body and back. Good. And the other side. Good. And then I'll have you lay over on your belly and we'll hyperextend. Good. You can hyperextend this one. Good. Hyperextend this one. Good. And now you can roll around to your back and sit up. We'll do your knees. Patient has full range of motion in his hips. We're now going to move on to the knees. So I'm going to have you flex and extend your knees. Both of them. Good. Good. Patient has full range of motion. Oh, you're good. We're now going to move on to the ankles. So we are going to plantar flex, so push down like you're pushing on the gas pedal, and dorsal flex, point up. Good. Full range of motion, push down and up. Good. And then inversion, which is going to be turning your foot in, and then eversion, turning your foot out. Good. Patient has full range of motion. We are now going to do the vertebral column. So I'm going to have the patient stand up and bend over like you're touching your toes. We're going to flex. Good. Now hyperextend, so come back up and arch your back. Good. And then we are going to rotate laterally. Good. And then turn side to side. Good. The patient has full range of motion with this. We're going to run through them all now against resistance to test for strength. So I'm going to have you turn with your head against resistance, so turn side to side. Good. And then forward and backwards. Good. 5 out of 5 strength. Now with your arms, have you go up. Good. And down. Good. This one, up and down. Good. And then we're going to go out. Push down and push down on my arms. Good. 5 out of 5 strength in the shoulders. Now the elbows. So you're going to go up. Yep. Don't let me break them. Good. And down. Good. 5 out of 5 strength in the elbows. Now hold your wrists out and don't let me break them. Good. 5 out of 5 strength there. Fingers out. I'm going to try and push them together. Good. 5 out of 5 strength against resistance. Good. Now we'll move on to the hips. So I'll have you lay down. Interiorly rotate against my hand. So up and push against. Good. And exteriorly rotate. Good. And same this side. Good. Good. 5 out of 5 strength. Now flex. Good. And push down. Good. Flex and push down. Good. Okay. Oh, and then we can go abduct and adduct. Abduct. And I forgot to do that one earlier, so we'll do that one now. So adduct away from your body and then abduct. Good. Abduct away from your body and in. Good. Awesome. Okay, now you can sit up. We're now going to test strength against the knees. So push against resistance. Good. Push against resistance. Good. And then plantar flex, so push down like a gas pedal and pull up. On the ankles, push down and pull up. Good. Knees and ankles are all 5 out of 5 strength against resistance. This concludes the musculoskeletal exam. We'll now start the neuro exam. So I'm going to start by assessing my patient's orientation and appearance. So can you tell me your name, date of birth?
Peter, and May 30th, 1990.
Perfect. And do you know what today's date is? 6th.
The 6th?
Yeah.
Okay.
Okay, and so my patient is ANO times 4, and his appearance is appropriate, and his cognition is appropriate. Now I'm going to test his tendon reflexes, deep tendon reflexes. So I'm going to start in the bicep tendon. And I feel visible movement there. Just relax. And visible movement there. Good. Now the triceps, so just relax. Good. And just relax. Good, and I felt visible movement in those tendons. Now the brachioradialis. Good, I saw some thumb movement there. Just relax. Good, and some thumb movement there. Now moving on to the patellar ligament right here, right above the knee. Good, there's some movement there. Good, and now the Achilles, which will be behind his ankle here on his foot. I see visible movement there. Visible movement bilaterally on both of those Achilles. I'll have you lay down. Do the Babinski reflex. So I'm just going to draw a line up the sole of his foot, and his foot plantar flexes, and up the sole of the other foot, and it plantar flexes. Good, now you can sit up here. So all of his reflexes are intact. I am now going to do test sensation in his upper and lower extremities of touch, feel, and vibration, or touch, pain, and vibration. So I'm going to start by just touching you on a limb. I want you to close your eyes and tell me what limb I'm touching you.
Left arm.
Good. Correct.
Right arm.
Correct.
Left leg.
Correct.
Right leg.
Good, and now I just want you to close your eyes and tell me if it is soft or sharp that I'm touching you with.
Sharp.
Good.
Soft.
Good.
Soft? No, sharp.
Sharp. Correct.
Sharp.
Sorry. And he got all of those correct. The sensation is intact. I'm now going to do vibration. So you can open your eyes. I'm just going to hit my tuning fork. Place it on his finger, on a bony prominence. What do you feel there?
Vibration.
Good. And what do you feel on this limb?
Vibration.
Good. I'm doing the lower extremities on his toe. What do you feel there?
Vibration.
Good. And the other foot?
Vibration.
Good. All of his upper and lower extremity sensation is intact. I'm now going to do the stregnosis test. So I'm going to have you close your eyes, placing a familiar object in your hand, and I'm going to have you tell me what it is.
Keys.
Perfect. Now the Grasthesia test. I'm going to have close your eyes. I'm going to write on your hand. You tell me what I wrote.
T.
Good. Correct. You got that right.
T.
Correct. You got that right. Awesome. His sensation is intact. I'm now going to do the joint position test. So I'm going to have you close your eyes and tell me if your joint is up or down.
Up.
Good.
Down.
Good. He is correct on both of these. Toes.
Up.
Correct.
Down.
Correct. Awesome. And next I'm going to have you, we're going to test coordination. So put your finger on your nose and then touch my finger. Good. 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 Now put your finger on my finger and touch your nose. Good. Awesome. All right, now we're going to do the rapid hand movement. So I'm going to have you tap your legs, flip your hands, tap. Good, and do it as fast as you can. Good, his coordination is intact. Now we're going to do the balance test, the sternal balance test. I'm going to close your eyes, I'm going to push against your sternal. Good, and he's able to hold himself up, his balance is intact. Now you can stand up with your arms out in front of you. Try not to let me close your eyes. Good, and don't let me push you down. Good, balance is intact.